down so
All right, so hello and welcome. My name is Amy Willardson. I am the outreach coordinator at the Reynolds Cancer Support House. Thank you for tuning in to watch our education session here on oral cancer screening and home care tips for oral cancer patients. We are pleased to have a partnership with the University of Arkansas Fort Smith Dental Hygiene Program. They've been a great partner to us over quite a few years, conducting oral cancer screenings here at the support house. We haven't been able to do that for about the last year because of COVID-19. So this year, we reached out to see if some students could do some education for us. So I'm pleased to have with us today, Yuliana Stasev and Abigail Pearson, students in the dental hygiene program. And they're going to take it from here and talk more about oral cancer screening and home care tips. Thanks, ladies.
Yeah, you're welcome. So yeah, like she said, we're going to be talking about oral cancer screenings and home care tips that you can take with you. So here are a few pictures. This is what oral cancer looks like. It can come in many forms. It's actually most common on the sides of your tongue and buccal mucosa, which is the inside of your cheeks. You can see that example on this big picture on the bottom right, as well as the top right.
So conducting an oral cancer screening at home is pretty easy. If you look at the pictures, you can just kind of take your fingers and feel around the areas like your lips and stretch out your cheeks and lips to see if you find anything that may be abnormal. So if there's something that's there for longer than 2 weeks or something like that, you can kind of keep an eye on it and take a look at it. You want to depress your tongue with a tongue depressor. And if you don't have that, you can use something like a toothbrush or even your finger. When it comes to pulling out your tongue and checking the sides, you can use a piece of gauze or just your fingers if you can manage to grip onto that.
Yeah, and this can be done by yourself, or if you have someone with you, they can go through these pictures and see as well.
And having a flashlight with that can be beneficial too.
Yeah, for sure. So we have a YouTube video that shows that. I'm not sure if it will come up, so we'll give it a try. There we go.
Oral cancer is a growing concern, particularly when you're over 40 and male. It's estimated that this year, 4,400 Canadians will be diagnosed with oral cancer, and 1,200 will die from it. Oral cancer generally responds well to cancer treatment if detected early. In between visits to your oral health professional, self-exam is the key.
To learn to do an oral cancer self-exam, ask your dental hygienist or visit cdho.org.
Were y'all able to see that? Y'all weren't able to?
No.
I think it took it to a separate page and that's why. So maybe exit out of that and go to YouTube.
Okay, let's see. Well, really the video just talked about the importance of home self-screenings, and it just reiterated what we said on the last slide. So should we just, you can copy this YouTube link and put it in the description below whenever we post our YouTube video. That would probably be easiest.
We'll do that.
Okay, awesome. All right, so a couple risk factors include smoking and chronic irritation. That's what Yuliana was mentioning earlier. That's anything that doesn't heal after about 2 weeks. That's when it becomes of concern. Alcohol, ill-fitting dentures, diet change, and immunocompromise, those are also risk factors. So if you are going through chemo or radiation, there might be some diet change. And that's what that means. It's not really like if you're on a diet like keto or anything like that, you're at risk. It's more of those major changes to your diet whenever you're going through cancer treatments. And then immunocompromise as well. If you're going through radiation or therapy and you have cancer, you are immunocompromised. So you're at a higher risk for these things as well.
And some effects of radiation and even chemotherapy on the oral cavity could be oral mucositis, and that's what dental hygienists term it. And for the general public, what you may know it as is ulcers. And then some infections in the mouth, such as bacterial, fungal, or viral, and then taste dysfunction and xerostomia, which is just another term for dry mouth.
Management of mucositis, what she was talking about, it refers to the red and ulcerative lesions of the oral tissue seen in patients with cancer. Like she said, chemotherapy and or with radiation therapy in these fields involving the oral cavity can cause these effects. Some pain control, you can use saline mouth rinses, which is salt water. Ice chips are topical anesthesia mouth rinse. We'll talk a little bit more about these things later on whenever we talk about what's in our care packages. Nutritional support, soft liquid diets will be really good for this, just not to irritate those areas. You don't want to eat anything very acidic, hard, crunchy, anything like that that could irritate those spots. And then for dry mouth, you're just going to want to really sip water. You're going to want to drink water pretty religiously, rinse with saline, chew sugarless gum, and then use those dry mouth tablets that we'll be talking about later as well.
Oral candidiasis, it's also known as thrush to some people. It's just a fungal infection within the mouth caused by the immune system whenever it's weakened. So you can see those white areas in the mouth is that fungus in there, and it can be prevented with good oral care and rinsing your mouth out after using an inhaler if you're needing to use one during treatment. And it can be treated with antifungal medications, and the treatment is typically 7 to 14 days. And some medications that you would see to treat this would be nystatin, fluconazole, and clotrimazole.
Awesome. So the items that we've picked for the care package that you might be receiving is some soft bristle toothbrushes, some of those dry mouth tablets, and then the Biotene mouth rinse. This is a moisturizing spray is the one that we have on there. And then some form of lip balm that's going to help with dry lips can also be a part of that. And I think, okay, yeah, I'll let you do this one, Juliana.
Okay. And other things you can be doing is regular dental visits with 4 to 6 months of those recare intervals. Brushing with a soft bristle toothbrush 2 to 3 times a day. So within the care package, we included a soft bristle, which will be beneficial, especially if you have some ulcerative lesions in there. You can use an antibacterial rinse. So if you go to Walmart, you can get any kind of mouth rinse that has antibacterial properties. You can use fluoride toothpaste with a mild taste, because if you do have those ulcers, a really minty, strong taste can really irritate those. And then you want to rinse with warm salt water as needed, and use lip care products to prevent drying and cracking of those lips. And that's why we provided the chapstick. And then additional fluoride use, such as professional treatment or prescription home products that you can talk to your dental professional about.
Here are just a few of our references and some of the online resources that we used for this information. And then if there's any questions that you have, we'd be happy to answer those. We did include a little brochure for the care package that explains more about everything that's in there, as well as the salt water rinse, just what the proportions are, the water to salt ratio. So that will be all explained in that brochure.
Very good. So if people do have questions, so if you're watching this, people have questions, you can give us a call at the Cancer Support House, which is 479-782-6302. And we will have information on those care packages and also the brochure that you all worked very hard on today. So if you have questions on that, and then if there's something we can't answer, we'll reach back out to the dental hygiene department at the university to help address any of those additional questions. Is there anything additional you ladies would like to add?
No, just those items that we included in the care package. Those are going to be really beneficial to anyone undergoing chemo or radiation, and even just to the general public for good oral hygiene. A lot of our tips, they're for everyone. And so even family members can benefit from the stuff in the care packages and as well as this presentation.
Very good. Well, thank you, ladies. You did a lot of really hard work. So we appreciate you sharing your information with us today.
Thank you for having us. We really appreciate partnering with you.
Yes, thank you.